The UC Davis Health Center for Simulation and Education Enhancement is a place where medical and nursing students can come to learn about real patient care in a controlled and safe environment. It's also a place where seasoned healthcare professionals can further hone their clinical skills and participate in transformative research activities.
We use technology to the greatest degree possible to try to replicate real-life scenarios that people can encounter in order to give them experience dealing with things that might be very hazardous or extremely pressure and time intensive, or just something that they haven't had enough exposure to in an environment that's safe for both them and the patients they'll be taking care of in the future.
Simulation's fun. Learners love doing simulation, and you can do so many things with simulation.
You do have the opportunity to stop and start time at will. You can do something over again if you feel like it didn't go quite the way you wanted it to. You can even do something in a different way while keeping all of the other variables constant. And to me, that's the real magic of simulation, because it allows you to have these fairly elaborate conversations about what's going on inside your head that we aren't given the opportunity to in real life just by the nature of the work.
The Simulation Center began in 2002 as a small space within the UC Davis Medical Center. It has since grown to encompass nearly 11,000 square feet within the Center for Health and Technology building. Today, the center also oversees simulation spaces within the Betty Irene Moore School of Nursing and the Education building.
When learners and educators come into the center, they're often amazed at how realistic everything is here. We have an operating room set up, a recess bay that mimics the emergency rooms. We also have a 6-bed ward and 4 exam rooms that mimic an outpatient setting. So on top of those realistic spaces, we also have the stars of our shows, such as this mannequin behind me. So these guys are actually pretty cool. They can show a variety of physiologic functions through breath sounds, heart sounds. You can even hook up an EKG machine to some of these machines. So in conjunction with a virtual monitor, you can actually provide a lot of the physiologic information that our trainees need to come up with a diagnosis in a simulated setting.
The center also offers task trainers that are ideal for teaching basic skills such as suturing and various airway management techniques that are vital for all healthcare professionals to master. The team is also highly skilled at developing and testing cost-effective simulation devices, such as this innovative lumbar puncture model.
A multidisciplinary and interprofessional group of us, including Aaron Lee from the simulation lab here, colleagues from emergency medicine, and I have gotten together over the past several years to really come up with a way to train people to perform procedures more safely, better, and with a lot of great fidelity, such as lumbar puncture or performing spinal taps.
The team also supports sessions that help pediatric nurses provide compassionate care for children and their families at the end of life.
These are experiences that stay with the families forever. We have such a tremendous impact in what we do, and it's time to really hone in on those skills and better understand how our own personal experiences, feelings, and biases can impact the family.
There's always more to learn. There's always more to create. And all of us need more practice at certain skills that we don't do all that frequently, or to learn how to use new devices, new techniques, or work in new environments that we haven't encountered before.
At the UC Davis Health Center for Simulation and Education Enhancement, we're dedicated to providing valuable learning opportunities for all healthcare providers. Contact our team today to learn how to incorporate simulation education into your curriculum and professional development activities.